Hi, my name is Dr. Ron Kurzeka, and today's topic is seizures. The key thing you need to know about seizures is what is a seizure, what does it really look like? Most seizures that we see are a grand mal type of seizure, but children can also have what's called a petit mal seizure, and you need to know how to identify that. First, a grand mal seizure is characterized by a sudden tensing of the arms and legs in which they get very, what we call tonic and very contracted. And then all of a sudden they start to shake. That's called the clonic phase. So they first get stiff and then they start to shake. And in a grand mal seizure, it's both arms and both legs. Although a child could have what's called a focal seizure, maybe on one side of their body or maybe only their arm or leg. The second type of seizure is called a petit mal seizure. And a petit mal seizure is a child has what's called an absence in which they just suddenly lose their contact with their surroundings and their reality, and they seem to stare off into space. And this is called an absence seizure. They're not really shaking, but they just lose their concentration and their focus, and they are sort of in a dreamy state. And many times teachers may see a child who has this and they may think that the child is really not concentrating or paying attention, but really what they're having is an absence seizure. So if your child appears to have episodes like that, you need to have your doctor evaluate the child and see if they're really having an absence seizure. And the way that we evaluate a child who has any seizure is we do what's called an EEG test, which is a brainwave test, which they normally do while the child is sleeping, and they monitor their brain waves and see if there's any seizure activity. So keep in mind the two main types of seizure, a grand mal seizure and a petit mal seizure, and also the treatment. The key thing for the treatment of a grand mal seizure is protecting the child's head. So if they have a seizure and they fall on the ground, hold their head or protect their head so that their head does not hit against the ground or any hard surface. For a petit mal seizure, they're typically not going to pass out, but you just need to be aware of how to recognize that. And the main thing is being an educated parent. And if you'd like to learn more about seizures, please read my book, The Total Parent. My name is Dr. Ron Kurzeka.